They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HS St. Anthony's Memorial Hospital.
Hi, I'm Keanne Armstrong, your host for Being Well. I'd like to thank you for tuning in today. We've got a really interesting topic today. We're talking all about kids and pediatrics. And today I have Dr. Mary Harvey with Sarah Bush Lincoln. She's a pediatrician. Thank you so much for joining me today.
Thanks for having me.
Yeah, I'm really interested in this. It's a great time of year to talk about kids. I mean, when isn't? But especially summertime. So, first of all, I'd like to ask you, how did you get interested in pediatrics? And then we may go into some summer safety here.
Sure. Well, in medical school, your third year of medical school, you go through different rotations. Pediatrics happened to be my last one. And I thought I was going to go into family practice, but I just enjoyed the pediatric rotation so much that it convinced me, why wouldn't I want to just do this for the rest of my life?
Yeah.
So,
well, lots of people out there turn to pediatricians for all kinds of answers, and hopefully that's what we're going to give our viewers today. So let's talk about some summer safety, some sun and pool safety and things like that. So what are some helpful advice that you can help us keep in the forefront of our minds when it comes to summer safety for kids?
Well, water safety is very important around pools, especially home pools, which may not be as supervised as a public pool with lifeguards. It's important to make sure that children and toddlers especially are safeguarded and away from it. And if they're ever at the pool, they're in protective wear. And it's important, it's a very important skill for everyone, especially children and babies, to start getting comfortable with water and learn to swim. So swim lessons are really important things for children to learn. Other summer topics, sunburns, sun protection with sunscreen and shading is important, not only to protect against burns, but for a lifetime of skin health. Damage to our skin actually builds up our whole lives, so protecting children's skin with sunscreen and like a SPF of 15 is fine, is really important, because whatever exposure and damage is happening to the melanin cells are actually building up, and it's an additive effect. It's also important to reapply the sunscreen every hour and a half to 2 hours. It's more important than the SPF, actually.
Really? Because I was going to ask you about that. There's all kinds of numbers, like 15 to 50, 75, whatever it is. How do you know what to choose? So 15 is okay, just as long as you keep reapplying?
Right. The increment of protection you get, say between 15 and 30, 30 to 55, is really not that much. It kind of decreases exponentially. But water handling, playing, all of that wears it off the skin. So reapplying it is actually more important than going up on a SPF. You could go to a 60, but leaving it on for 3 hours, you could still get a burn. If you had like a SPF of 15 and you put it on an hour later again, you're going to be better protected that way.
Well, and also when they're in the pool or, playing on any kind of water equipment or outside water parks, different things like that, you just want to make sure you keep applying it so it doesn't wash off. Even if it does say waterproof, it's probably better to be sure to put it on.
Yep, it can come off with rubbing against toys, and kids are wrestling and it comes off on hands. So yeah, it does need to go back on.
And probably also think about, I'm thinking, maybe hats or sunglasses, different things like that. So not just sunscreen is important.
Right. Eyes are important to protect retina, and hats are really good for shading. Years and years ago, there were some sunscreens that contained a chemical that could have been absorbed into baby skin and was dangerous. That isn't in products anymore. That was outlawed. So it's actually safe to apply sunscreen to a baby who is less than 6 months old. So that's kind of gone by the wayside, that you shouldn't apply sunscreen to babies 6 months and younger. But they're still very sensitive to the sun. So the best thing is, keeping them shaded and out of the sun altogether.
Okay.
Hats, under a roof.
Skin
umbrella.
Or those rash guards, like the shirts that they can swim in now too.
Yeah.
Hey, you brought up something just a minute ago when you were talking about chemicals in sunscreen. What about protecting kids from bug bites and things like that? Give us some tips on maybe how to protect kids from insects.
Well, there are sprays, and that's probably the most effective as far as keeping bugs from biting. Some people just happen to be more naturally prone to attracting insect bites than others. Yeah. So really the avoidance, the best thing would be a spray, unfortunately, and you hate to think of putting chemicals on, but you got to weigh your,
Right, yeah.
advantages, disadvantages. Most of the time, insect bites are harmless and just annoying, but sometimes they can get infected, especially if they're particularly itchy and get scratched with a dirty finger and, open up a wound where a germ can get in. It can seed an infection. So when there are insect bites, it's important for parents and caretakers to look at the bite regularly, make sure they're not noticing any pus or increasing redness over the course of days.
Okay. What about bee sting or wasp sting? What's the best thing for an adult to do if a child gets stung? What's something they should do first?
The first thing to do, if a child's not allergic to that, because there are people who have anaphylactic reactions to those sort of things, but if it's just a local reaction, sometimes just ice to soothe it, or a cool washcloth can be helpful.
Okay, and then just let time take its course?
Yeah, I wish there was more that you could just do to erase the pain, but yeah, it's usually acute severe pain, and then it gets better with a little bit of time, sometimes quicker than actually a pain reliever like a ibuprofen or acetaminophen could do. So it's not always worth treating them. If a child is anaphylactic, and does have reactions, it's of course always important to have an EpiPen available. Okay. So travel with a child, and sometimes that's hard to remember in the summer because they're not in their structured school environment where it might be at the school office or whatever. Right. So
I don't go anywhere without a first aid kit.
Yeah.
I think it's important because a lot of times if you're at the playground or somewhere where there's kids who are playing and having activities, someone's going to get scratched or hurt or something, and it's just good to keep on hand, I think.
Yeah, and if there is an insect bite or a scratch or a scrape, cleaning the wound is a good first step too. So clean it, make sure that there isn't any dirt or germs that are going to get into it, and then after that, maybe an antiseptic cream and cooling it off topically.
All right. Hey, during the spring and fall, there's a lot of times where kids have allergies and different things like that. How do you know if it's something that's triggering an allergy versus a cold or a virus or something going on? Give us some tips on that.
Well, I think if having a fever is a differentiating symptom, with allergies, you shouldn't have a fever. A lot of the other symptoms can be the same: congestion, runny nose, runny eyes, cough even. And those things are annoying, but they're not dangerous. And even if a child has a fever with all of that, it may just be a viral infection, which again is not dangerous, but sometimes it's worth getting checked out to make sure it didn't seed any deeper and lead to an ear infection or worse, say, a pneumonia or something like that. But a fever is probably the point at which I would consider it an illness rather than an allergy, like a more contagious illness.
Okay. People you hear sometimes are, hesitant sometimes to give medications to children, or you hear a lot about vaccinations and things like that these days. And, what do you tell parents about antibiotics or over-the-counter medicines or vaccinations? Let's cover some of that a little bit.
Sure. Well, over-the-counter medications, there aren't a lot of over-the-counter medications that are very useful for kids, like cough and cold medications really sometimes can actually make kids feel worse than they do better. For adults, sometimes they can mask symptoms enough so that it's easier to go to work and not sound stuffy, but for kids, that's probably not as bad as maybe the jitteriness they might get or stomach ache they might get from cough and cold medicine. So I'm not a big proponent of those. Acetaminophen, ibuprofen, those are pain and fever reducers, and I think it's fine to use those when needed, whether there's a fever or pain. Fever itself isn't dangerous, but it's important to note because it is a symptom to kind of add on to other symptoms when taking an illness into consideration. However, anybody who's got a fever, whether it's a child or adult, is going to feel crummy, so bringing the fever down is nice so that they feel a little bit better.
You don't want to feel
and you
like
want them
that.
to drink fluids and stay hydrated, so it's
Very
easier
important.
to do that if you're not feverish. As far as antibiotics go, there has been a tendency for antibiotic overuse over the last many decades. And antibiotics are good when they're needed and bad when they're not. So it's important that they're prescribed appropriately. Antibiotics won't work on all illnesses. Viruses do not respond to antibiotics because they're not bacteria. Antibiotics specifically kill bacteria, and not all antibiotics work on all bacteria. So it's important to be aware of that and know that if a physician's prescribing an antibiotic, it should be for something real specific, which would be like a bacterial illness, whether it's strep or pneumonia, that we would suspect as being caused by a bacteria.
All right. What about vaccinations and maybe school readiness too? Can you talk about what needs to be done, what parents need to keep in mind, either at the ages that kids need them, or also what they need to prepare if their child's getting ready for school?
Sure. As far as school, before kindergarten, there's some vaccines that are required by the state, and prior to that, infant vaccines would have brought them up to date, where there might be a couple years before the child's had immunizations. Although we do recommend, even for babies 6 months old and older, that they get flu shots every year. Those are very important. Vaccines are safe, and there are vaccines given at kindergarten. As far as the next round of required vaccinations by the state, it doesn't come around until 6th grade.
Okay.
So there's a pretty big gap in there of when the required immunizations come around. And again, that's not including the flu shot, that's every year. At 6th grade, there are some, even in kindergarten and earlier, there are some immunizations that are available that aren't required. That doesn't mean that it's not a good idea to do them. Immunizations are very safe, and if you could protect your child from an illness, why wouldn't you? I mean, before kindergarten, we offer a hepatitis A vaccine. That's not required by state or government officials, and may never be. I don't know if that's coming down the pipeline as far as legislation. Once girls and boys get to be 11 years old, we offer an HPV vaccine, which is not required. Again, it's a very, very great vaccine as it protects against a lot of cancers. I wouldn't want you want to protect your child.
Right.
So yeah.
Think ahead.
Yeah.
So let me ask you about, you're talking about different guidelines and things like this. Kids are on the screen so many hours, it seems like, if you don't monitor that. What is the guidelines for screen time versus physical activity, and summertime versus school time and things like that? How do you balance all of that? What's your tips?
Well, that's a good question. The American Academy of Pediatrics just recently, I think a couple months ago, published some pretty clear-cut guidelines. Really, 6 months and younger shouldn't have any screen time. And as far as up to 18 months, really, it should be very, very specifically educational and not more than a half hour.
Okay. And why is that, I guess? Explain why that is. Why do they have these guidelines in place? Is there things that affect the child if they have too much screen time? They basically are not interacting. They're not using back and forth communication. They're not physically active during that time. It's sort of just, occupying them without using any skills that they need to develop, like reading, or, when they're playing outside or playing in the house, they're manipulating, say, toys or blocks and developing skills. And those are windows, of opportunity lost if they are wasting time just staring at a screen. Right. It can be helpful. Here we are at PBS station. We offer PBS Kids and educational activities, but we always say, watch it and then turn it off and do something about what you just watched. Read a book, do an activity, so you're not having too much screen time.
Absolutely. And then, even younger than middle school, a lot of schoolwork requires online investigation, studying, reading something related to a video or a search. So we can't say that you can erase all screen time, because that's not realistic. Yeah. But there is a difference in the quality of screen time. I mean, social media doesn't offer much. And there've been studies to show that it's actually kind of a negative impact on middle school and high school kids. But there are a lot of academic things online that, and even on, the phone, that can help and are useful for school too.
Right.
But going more than a couple hours a day probably is going beyond what is useful.
Yeah, just kind of limit the time, make sure that you're keeping mindful of the time, and it's best probably for adults to stay off their phone a little bit more too.
Right. Yep, and keeping the quality high.
There you go. Hey, a topic that I think of often, because my son is a very picky eater, what do you suggest for some of these kids that maybe don't want to eat meat, or they're like, ugh, I don't like the texture of that, I'm not eating anything with sauce, or, give us some helpful information on how to help our kids have a balanced diet.
That's a good question. Very broad. I guess I would start when children are very young and starting to eat. It's important to offer a lot of different flavors and textures so that children are more exposed to different types of food. And it's not something new when they've already maybe established some likes. So at an early age, through toddlerhood, offering wide variety of options, is good. It's important to know that kids aren't always hungry when we're hungry. As adults, we tend to be hungry more often, and we'll eat 3 full meals a day, sometimes and snacks in between, whereas children and toddlers especially may just snack. So it's important to make sure that the food that's being offered during those snacks is healthy food. Don't give in and say, oh, she'll take a cookie. I wouldn't go there. Just offer fresh fruits, vegetables, cheese. If those are going to be the snacks, if there's going to be snacks, make sure the snacks are what you would want the meal to be.
Okay. What about drinks and soda drinks, juices, things like that?
That's a good question too. Really, water is super important. It's the healthiest thing we can drink. The sugar that's in juices or in sodas is not good. It's just not nutritionally valuable. So surprisingly, juices don't offer much, and skipping them altogether isn't a bad idea. Toddlers shouldn't have more than 24 ounces of milk in a day, because sometimes that can lead to problems. But other than milk and water, there really isn't anything else that's really healthy to drink.
All right. Stay hydrated.
Yeah, stay hydrated, drink enough water, and every now and then for a little treat, juice is okay, or a soda occasionally. But as far as mainstay of staying hydrated, water is the best option.
And limit the sugar.
Yes.
Yeah.
Yes.
Well, not only for hyperactivity, but also to do their body good.
Yeah, free sugar just really hasn't been proven to help us with anything nutritionally, except for in cases of emergency. But yeah, more complicated the carbohydrate is, the healthier it is, and sugar is about the least. So.
Right, yeah, for all of us.
Yeah.
Hey, you hear about kids getting ear tubes a lot lately. I guess, because I don't know if it's just colds and things that lead to it, ear infections, if it's allergies. What can you tell us about ear tubes? How to know when it's just a minor ear infection, when to take them to the doctor, what to do about ear issues?
Well, ear tubes are a surgical procedure where a tiny tube's inserted into the eardrum itself, way deep inside the ear. Now, what that does is it just creates an airflow between the back of our throat and the external ear, so that fluid can't build in the middle ear. So ear infections come from when there's fluid building in the middle ear, which is really deep inside of our ear, behind the eardrum, and it's trapped in there, and it's a wet, warm place. Whether it's mucus from a cold that starts it, what happens is the bacteria can get in there, white blood cells get in there, and it basically turns into an abscess. We try to treat that with antibiotics, but sometimes it doesn't work if it goes on for weeks and weeks and we've switched up antibiotics. That might be an appropriate time to go to the surgical route and have a tube placed. More often it's recurrent ear infections where a child may have, say, 3 or 4 in one season. We think about tubes at that point, or 6 in a year. Those are sort of the guidelines we use of when a surgical tube placement might be appropriate, which in case we would refer the child to an ear, nose, and throat doctor to do that.
Okay, so if they are having recurrent ear infections, that's more often the time to look into that.
Yes, yep, and there are specific number guidelines on how often and when. So, during one season, if it's 3 ear infections, or if it's 1 year and it's 6 ear infections or more, that's usually the recommended guideline to follow.
Yeah, and you don't want your child to suffer. That's painful. They don't feel good, things like that. So good to keep in mind. If they do have ear tubes, what about being in the water, in the pool and things like that?
That's a good question, and actually it's a controversial thing whether water should be in there or not. Some ear, nose, and throat physicians will recommend plugs, others don't.
Okay.
So that's a difficult one to answer. I'd say just follow the guidelines that your specific ENT gives you.
All right. All right, well, hey, we have covered so many topics today. I'm sure there's lots more to cover when it comes to kids, and you get asked all kinds of things in the office, but it's been very informative, very helpful. I want to thank you so much for being on today's episode.
Well, thanks for having me on.
Absolutely. So once again, we had Dr. Mary Harvey with Sarah Bush Lincoln, a pediatrician. Lots of helpful tips today. We want to thank you for watching, and we'll see you next week.
At HS St. Anthony's Memorial Hospital, we are at work transforming heart care, rebuilding knees and hips, delivering new generations, and focused on providing health care to you. We are HS St. Anthony's Memorial Hospital.
Meeting the ever-changing healthcare needs of our communities, Paris Community Hospital Family Medical Center is now Horizon Health, with the same ownership, management, providers, and employees. Horizon Health provides patient care and promotes wellness to the communities of East Central Illinois.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.